will open the floor for discussion regarding our main educational strategy here in this college, which is problem-based learning. So I had an interest in understanding what is the concept behind problem-based learning and why people are adopting it everywhere, so that we can apply it to the best way possible here, since it is our main teaching modality, and how can we improve it? Okay, and what are its advantages and disadvantages? So most of what I say will be a mix of what is mentioned in the literature plus some of my opinion. My opinion may be right or wrong, but in general you will come to understand that there is no right or wrong in problem-based learning because there are no set rules in general. So what is PBL? There is a great deal of confusion about what is meant by the term PBL, and there is lack of clarity about what are the principles of PBL. Why are we using it? What is the aim? Okay? So there is one publication in 2008. I think this is the best publication. If you are interested in knowing about PBL, this is the best source you can read. It's like a mini book explaining why there is so much confusion about PBL. Okay? Part of this relates to when people are implementing PBL, they modify it according to their context and how much time, resources they have. So multiple modifications occur, and when people apply PBL in their institute, all people who work in this place will think this is the method that you use PBL, and this is the right way to use PBL. So when they go to another place, they will think, no, this is not the original PBL idea. So multiple variations happen. So it is good to understand what is the original concept according to the person who introduced this concept, which is Burroughs. This is his definition. He called it a learning method based on the principle of using problems as a starting point for the acquisition of knowledge and integration of knowledge into practice. So PBL is not exclusive to medicine. It can be applied in any other field of education, but it started in medicine. So in medical education, PBL is an instructional, student-centered method that uses problems as a context for students to define their learning needs, conduct self-directed inquiry, apply theory and practice together, and develop solution to this defined problem. In order to do that, they have to meet several times a week to fulfill these objectives. So basically what you want the students to acquire through the PBL process is two things. One is knowledge, and the other thing is problem-solving skills. So the traditional way is to impart knowledge only through lectures. But with PBL, they acquire knowledge and problem-solving skills, in addition to many beneficial skills from the interactions, including communication, teamwork, and lifelong learning skills. So they will develop all of these through the PBL process. So those are the 6 characteristics of PBL that are generally applied to any form of PBL. The learning is student-centered. It occurs in small groups. The teachers are facilitators. Problems are the organizing focus, and problems are the vehicle for development of learning. And new information is gained through self-directed study. So why people are using PBL? What is the rationale for the implementation of PBL? So PBL is based on what is known as adult learning theory, which means how do adults learn? You are an adult, so how do you learn things, right? It's not similar to how children learn. Adults learn, or the best way for adults to learn is based on a theory. this theory states that adults are motivated by learning that is relevant to their needs. So you want to learn things that are relevant to you and that are building on what you already know, right? And they come through motivation internally. So you have to be motivated in order to learn. No motivation, no learning. Your learning, you want it to be applied in your practice, and it is practical with mutual trust, which means you trust whoever is going to teach you, and whoever is going to teach you trusts you. There is no, so you don't look at your teacher as a person of higher status, right? So you look at it as a peer, like what we are doing in PBL. So this assumes that your students are mature adults, so they will learn better through PBL. Students should not prepare. The idea is to give them the problem as a fresh state, right? Without any prior preparation, right? Why? So the reason is to activate prior knowledge. So again, the students, it means that the student have some knowledge in the past in order to activate this knowledge. If students prepare, okay, what will happen? There will be variable preparation. Some students may even go to the level of understanding everything about the case, right? So they will read what other students will said in the past, and they will analyze this problem by themselves, like what they are doing in the PBL. And they end up knowing everything about the case, which makes the exercise of PBL not useful, right? So the idea of activation of prior knowledge is a key of PBL, and it allows the students to, if they activate the prior knowledge, this will allow them to retain this knowledge better, right? To make it more, stick more in their mind. The tutor. So the tutor's task you already know about, right? We will discuss them more in detail and what are the issues with tutor work. Okay, those are the general tasks. So let's go directly into the steps, step by step. Okay, so in general, what is the ideal number of students in a BBL group?
From 8 to 10.
8 to 10.
8 to 10. 6 to 8. So if you read the literature, most people will say from 6 to 10. The ideal is 8. It can be a little bit more, little bit less. More than 10 is excessive. Less than 6 is also not appropriate. So the original PBL model, the person who, Dr. Barros, his first cohort composed of 50 students, and for each group they had 5 to 6 students per group, right? So it shows you the number of students are increasing in colleges, so colleges have difficulty in coping with this increased number with the BBL model. If you increase the student number, what will happen? What do you think will happen? What is the deterrent?
The time will not be sufficient for each student to take that chance to share and
Exactly. Yeah. And for you as a tutor, you will not be able to assist each student. It is difficult to know all of them, right? And the students who are not active will get away easily in this situation, right? So this is why the number is important. The rules of group members, the classic rules of group members are 3. You have a reader, you have a scribe or secretary, and you have participant. This is the classic rules. But many people have got additional rules, like what we are doing now: patient reporter, case presenter, feedbacker, chair, etc. This is all new. So this is not in the original concept. Even the chair, the original concept used the tutor as the chair. right? But now we want the students to become chairs, right? So you see the difference. Self-directed learning. What should be done by the students? Now they have their learning objective, okay? Who should look for the learning objectives? Who should identify the answers? Is it one student? Or all? All. Okay, so all of them should search for all the answers. This is the ideal situation, right? Okay. Are we applying this now in our situation? Not everyone does it, right? Maybe some of you does it, but how can you make sure they have done this work? Okay, each one will try to do some way in order to make sure the student does that. Okay, so everyone has their own opinion on this part. Sometimes it is good to assign a specific learning objective to specific members in order to motivate everyone to search for the learning objectives, and each one will know what their task is, right? What about the rest of how can you motivate them to study the learning objective of a given problem scenario? There are multiple ways. The problem is that we don't have a concrete way of motivating the students to reach to study about the learning objectives, right? Because they are not really directly assist on that. And what we are doing is we assign one student for presenting all of the findings, which is not the way PBL is supposed to be, right? Another issue regarding the resources. What should the student use? You have many resources. When PBL was originally done, there was no internet, okay, and there was no universal access to information. So students used to, in order to identify the learning objectives, they go to the library and they ask their content experts. This is the ideal situation. But now, with the prevalence of information, they don't need to do this. So they don't actually use the library or anything. They just directly go to the internet. And what is the problem of internet? The information is not
authentic.
Not authentic, many of the time. Students may reach wrong answers, may have wrong understanding or superficial understanding. So what is the solution to this problem?
Can give them idea about the trusted sites or trusted websites.
Good, so this is one idea. What is another way? Another way I think about it is after the session, for each topic you should give them some reference, exact reference to read from and to get the information directly from. Otherwise, they will search here and there, right? And sometimes, with the abundance of information, they will not know what is the right answer if every resource tells them something else, right? So, in summary, some key concepts of PBL to keep in mind. Number one, there should be no advanced preparation by the students. The primary aim is not problem solving, but identification of learning objectives. And this identification should be triggered by the curiosity and the want to learn by the students to solve this problem. And this is the original idea by Boros. Activation of prior knowledge is key for PBL. And learning needs are different from group to group and should not be strict 100%. You should give them some space regarding their learning objectives. Okay? So, due to the limited time, I will choose a few things to discuss. Okay? Let's go to advantages and disadvantages. Okay? So, as you know, advantages of PBL. In PBL, knowledge is acquired in context. Knowledge is built, what is already known, and there is activation of prior knowledge. And with activation of prior knowledge, there is aid in knowledge retention. and it encourages critical thinking by the students. It increases the interest and motivation to learn. It develops the skills for teamwork and for lifelong learning. Okay, let's go to the disadvantages. So before we can go, this one stages of intellectual development tells you one of the advantages of PBL. Okay, so intellectually, the students, when they look at information, okay, there are stages of looking at this information. The first stage is dualism, where the students look at the information as whether it is 100% right or 100% wrong. There is no gray zone. So you should give me the right answer to the question. Okay, and this is not the way you want your students to be. And this dualism is the result of continuous didactic teaching to the students. Right? So they always think there is one right answer, one wrong answer. And also as a consequence of the assessment methods we use. Right? But this is not the reality of the world. Right? So the second is multiplicity, when they think there are multiple possible answers to one question, and those answers are equal. The third stage is relativism, where there is no multiple answers. There are this is like a spectrum of answers. And the fourth stage is commitment, where they realize not only there are several answers, they should be able to choose one answer according to their understanding and commit to it out of the available answers, right? So PBL helps you in allowing the students to reach the state of commitment. Okay? Now let's go to the disadvantages. The disadvantages are longer than the advantages. Okay? So we can look at them through multiple issues in the PBL. So disadvantages of student learning, of faculty, of content, of cost, etc. So regarding student learning, in general, medicine has a moderately well-defined body of knowledge, which includes best practices guidelines for many of the problems people face. Right? So most people refer to those guidelines. And one problem with PBL is that it has a hunt and gather approach that is unstructured, which causes learners, instead of reaching the answer directly, they will spend a long amount of time in order to reach this answer, usually from this internet. Instead of short time, it will increase the time for finding the answers. So this inefficiency is often frustrating to the students and can be extremely time-consuming and may result in erroneous information if they find wrong information. Right? The students may use non-reliable resources also, and with some mistakes if not guided, especially if the tutor is not keen on instructing them. Knowledge of basic sciences is lower and less focused. One problem we face currently in not everywhere, but here, for example, there's a problem of non-mastery of English language, which causes difficulty in learning in the context of PBL for students with English as a second language, right? Staff. PBL makes it difficult for students to identify with a good teacher as a role model for them, an inspiration for them, right? Because facilitators do not really work as superiors to the students, right? Yeah. PBL does not motivate the staff to share information with the student unless the student asks them. So they are not keen on sharing information, and they are instructed not to share information in the session. Staff are denied the enjoyment of sharing what they know and their experience to the students. So it is left to the student to learn by themselves, right? PBL requires competencies that many faculty do not possess, right? And in order to overcome this shortcoming, there should be faculty development programs that are robust and continuous, right? Not a one session thing. Time. PBL is more costly than traditional teaching, and it is more demanding in terms of cost, in terms of number of faculty, in terms of faculty time, and in terms of resources, right? And it is more difficult to maintain, not only to initiate, also to maintain, because in order to maintain in a good, healthy curriculum, you have to revise your content every now and then. So you need faculty dedicated to the revision, medical education, and many things. So the bigger the student numbers, the more difficult it is to implement. So there was one question in the literature: what is the number of students in where PBL starts to appear more costly? Some literature say that there is no difference between classic and PBL in terms of cost. Okay, but these studies use lower number of students. So one study aimed to identify the number where students will be, the cost will differ. Okay, so the number is 100. So above 100, the cost of PBL will increase, and the more the students, it's not a straight slope. It is like the more the students, the more exponential the cost of implementation. So many colleges now are shifting to the hybrid model, not because PBL is not effective, because of cost issues, right? And the pressure to increase the student numbers. Content. PBL is an ineffective way of imparting high volume of information. For 4 hours, you are discussing one topic, okay? But in the didactic, for 4 hours, you can discuss so much. Groups often end up reaching different conclusions, sometimes based on their interpretation of different sources of information. So students who are keen on knowing everything will find it frustrating because they will not be able to know what is actually required from them, right? Because it is an open process. They are often left with uncertainty as what is the better answer, especially for assessment exercises, right? And they can complain sometimes where they find an answer and you tell them, no, this is the right answer, and many complaints are because of this reason. The lack of scaffolding structure of the curriculum of the learning may lead to frustration and delay in acquiring clinical reasoning skills. If they have a scaffold of learning, it is much easier for them, rather than just to throw it on them. Okay? Another issue is secondary school versus bachelor student graduates in PBL. PBL has been proved to be more effective with graduate students rather than secondary school leavers, right? Original PBL model, when it was initiated, it was applied on students that already have bachelor degrees in science, chemistry, biology, etc. So they have good amount of prior knowledge and can activate this knowledge to allow coverage of the gaps. But for students who don't have this, it's a problem. Not only that, also our students have this knowledge in Arabic. It's not English. So they first have to translate this information, and it is limited by their secondary school. So this is another hurdle, right? So, and another problem is that the tutors are not allowed to give the students the information. So what are they supposed to do, right? So in general, if you are delivering traditional teaching well, it is almost certainly better to implement PBL badly, right? That doesn't mean that PBL is bad, but in order for it to be good, it has to be implemented well. Otherwise, it's better to stick to traditional teaching, right? So, how much time? We have 5 minutes, okay? So, is PBL effective? Have there been studies assessing the effectiveness of PBL? Yes, so many actually, innumerable. If you will go to the literature, you will not be able to get a concise number, hundreds. So what is the result? In order to know the result, you will check for meta-analysis of these types of study. What did the meta-analysis say? It said that at best, PBL is not worse than traditional curriculum. Okay, but it's not consistently better. So the problem with these studies is that it is hard to assess the effectiveness of PBL. We can agree on that because the studies may not be entirely accurate because you are assessing outcomes. How are you assessing those outcomes? Right, through exams that test factual recall, for example. So of course the traditional will be better. Right, so this is one issue of the studies. But many people are trying to publish papers that show the advantages of PBL because this is the trend. Right, so the accumulation of evidence is conflicting all the time. And in recent years, more schools have moved to the hybrid curriculum model, which I can explain if I have time. Reasons for variability in outcomes: the experience of curriculum planners, the student's age, as I said, and prior experience, the degree of institutional investment in the program, and the methods of assessment are also key to success of PBL, right? So, in hybrid PBL, what is hybrid PBL? Is addition of PBL to complement other teaching methods, including lectures, practicals, clinical rotations, and computer-assisted learning. So this is what is hybrid PBL, and there are 4 levels of hybrid PBL according to how much PBL you apply in your curriculum, right? For type 1, it's like superficial addition of PBL sessions in a big curriculum, maybe 2 or 3 sessions per semester only, for example. And this is not the main modality. This is level 1. Level 2, when the main curriculum is traditional, or whether it is discipline or integrated, it doesn't matter, as long as it's based on the traditional methods of teaching, lectures, practicals, clinical, and PBL is used to enrich the students' understanding of their knowledge. This is level 2. Level 3, when the PBL is the core and the lectures are used numerous activities other than PBL to enrich the PBL. So PBL is the main thing in level 3. Level 4 is when PBL is the main thing, but you are not using many other activities. Maybe a few lectures here and there. Right? So this is the levels of hybrid curriculum. What do you think our situation applies to which one? Three, right? So, yeah. So exactly, this is what I thought also. Now, is 1 minute. Last slide, okay? I have many, but...
Generally, you have a 50 minutes class.
15 minutes class? Yeah.
Today you have 60.
60, so it's okay. Many of you take 60 minutes also. Because you don't have time to explain
No
what
time
you
for
want.
tea.
Abdulrahim, takes a big time.
No time for tea.
Takes a big time.
It's
Break
okay.
time. We take a big time from the study. You can take
Yeah,
also
I
break
can
time.
take break time.
Like we
Please
do.
get it.
So I can stop anytime you want. It's okay. So last part, is PBL the only modality you can use for small group teaching? Are there other things you can do? Yes. Yes, many actually. Okay. So there are many modalities of small group teaching other than PBL. But there are 2 that rose to prominence in the recent years in medical education. One is called team-based learning, and the other is called case-based learning. And the main advantages these methods offer in comparison to PBL is that the learning is more guided, right? And the students have a clear idea on what is asked of them, right? So if you want, you can go through this diagram to show you the differences between case-based, team-based, and problem-based learning. And this is another table to if you want to go through to understand these new methods of medical education. And many actually universities trying to apply those to improve the students' level. Okay, I think we can stop here. Let me go through this one. So this is my personal opinion on how to improve PBL in our situation. Okay, so I think the key to success of PBL is the problems. Okay, this is my opinion. So you have to have huge emphasis on what you are giving the students. The problems, okay? So problems should be appropriate for the level of the student. Not something overly complex and not something very simple, not to trigger interest, okay? Problems should simulate the natural flow of events in clinical situations. Some are giving problems in levels, like first they give the history and then they stop and discuss, and then give examination and stop and discuss, and then investigation and stop and discuss. So some people are doing it this way. The problems should have something unanswered. I find that some of our problems have the answers directly. So if you have this, there is no interest for the students to search for the answers, right? And questions, sometimes problems should also stimulate the discussion. They should not be something simple and easy, right? Then they will not stimulate the discussion, and they should be frequently revised because we know students take from previous batches, so they already know everything about the problem, right? Frequent revision is important, and there are ways to write the problems. There are guidelines on how to write problems for PBL. The second point is guidance to the students. So the student should be better guided, especially at the beginning. There should have clear learning resources. We should not just leave them to search the internet by themselves. Right? We should give clear sources, the good website they should use, not anything, not just Google it, right? And give more incentive to encourage self-directed learning by focusing the assessment more on knowledge rather than behavior and attitude. You can assess both, but you should put the major emphasis on knowledge, right? And so that students will be motivated to learn. If they know they will not be assessed on what they know, they will not be motivated, right? And give more incentive for teamwork through even distribution of the task. You should not just assign the task to one student and that's it, right? And you should know how can you assess every student. And changing of assessment modalities, as I said. Okay, and that's it. This is my references. Thank you very much.